Chu?
Hello, everybody. Good morning and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgilla, Hispanic Public Information Officer, and joining us today is Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as Mr. Sean O'Donnell, Program Administrator of Public Health, Emergency Preparedness and Response for the Department of Health and Human Services. Members of the media, do use the chat during the Q&A portion of this presentation. And with that, good morning to you, Mr. County Executive.
Good morning to you and good morning to everybody joining us this morning. Today I'm speaking to you from the Metropolitan Washington Council of Governments, COG, as we call it in the short form. And I'm attending a board of directors meeting here. On the agenda today, there's going to be a discussion about the Regional Housing Equity Plan, as well as a presentation from the Amazon Equity Fund and Housing Equity Fund. And I wanted to be here for this and for the discussion. Creating and maintaining affordable housing is a problem for this entire region, as the Hand report showed when it came out in the late spring. And it's as much a problem in the region as it is here in Montgomery County. It's important that we're all working on this problem together. And I look forward to the information that's going to be presented today. But I'm going to start my remarks with a few of my thoughts about yesterday's election. Political prognosticators and pollsters have been predicting a red wave nationally in this year's midterms. The good news is that this did not come to fruition, as issues such as reproductive rights of women, threats to democracy from election deniers, and the trust that a lot of Americans have in the Democrats over Republicans was evident in the election results. I'm very grateful for the support I received to be reelected to Montgomery County Executive. And I'm also thankful to my family, my campaign staff, and our volunteers, and the voters for their support and acknowledgement of what we did achieve during the last 4 years and our efforts to move a vision for this county forward. I also want to express my appreciation to the community organizations, the advocacy groups, the unions, all of the community effort that supported my campaign from before the primary through the general. When you think back to 4 years ago when I won the county executive seat, I imagined that there would have been a normal path to moving things forward. And then came the pandemic and hit this country at a scale, depth and breadth that we had not seen in over a century. And by most measurable outcomes, the county responded to and handled this better than pretty much any other large jurisdiction throughout this entire country. We became the most vaccinated large population with a death rate 2/3 of our national average. And even more significantly, we were able to vaccinate people equitably in this county. And that was a pretty significant achievement, and it required the county actually pivoting and making some changes in the normal way we do business in order to achieve those goals. But the pandemic also forced us to refocus spending and use of our staff on efforts toward protecting the community, and it limited our ability to act immediately in some areas. We know that the guidelines for the council for 2 years were basically the same services budget, which really limits your ability to do anything new. But all of us were uncertain about what the revenues would be, and you cannot get back the money that you spend if you don't have it, and that would have created real problems for the county. So we were cautious. Cautious was the approach that both the council took and we took, and it's just nice to be in a little bit different position now. But just because the pandemic had our attention and a lot of our effort, it was not our sole focus. We inherited a $90 million deficit, and we turned it around to the point that we have revenues, and we've been able to provide record funding to education, affordable housing, transportation, infrastructure, and combating climate change. And we did all that without having to raise taxes, which gives you an idea that things were moving in our favor as we moved out of COVID, that helped us increase our revenues without having to mess with the tax rate. We fought for it, and we passed forward to the council legislation that will move us forward on environmental sustainability. We have proposal for temporary rent stabilization, and I'll be sending different proposals forward on housing to the new council when they're seated. We've made efforts in public safety, significant ones, where we were able to finally increase police pay so that it's competitive. And one of the immediate benefits has been increasing the size of our recruit class from as low as 11 to over 30 this time. And that's a big change. And if we can sustain this, we can reverse the trends that led to our police force being understaffed. Pay was a big issue. Having addressed that, now we are in a better position to compete with other jurisdictions. And we still have a really strong benefits package, and frankly, one of the safest communities in the region. So there's a lot of reasons to come here. We also were able to move forward on our affordable housing goals, and you'll be seeing more from us. But we've been able to provide a substantial amount of funding for affordable housing. Last night, it became official that our new council, which is now 11 council members, goes from 1 female member to now 6 female members, making a council majority of the female members for the very first time ever. And this is the most progressive leaning council that's coming into place in many, many years. And that makes me very excited to work with them. And I look forward for the opportunity to work together on a number of issues. I also want to congratulate our new governor, Wes Moore, and Lieutenant Governor and Montgomery County native, Roberta Miller, Attorney General Anthony Brown, Comptroller Brooke Learman. All these victories are historic firsts for African Americans, Asian Americans, and women in our state. So there's a lot of great news in our state in the realm of making progress. Senator Van Hollen and Representative Raskin easily won re-election. The Trone and Parrott race is still too close to call. We knew it was going to be close going into it, but we're still optimistic after all the votes are counted that Representative Trone will actually win re-election. Probably kind of be like my election. We'll be waiting a week to get all the votes counted, but I think they may well turn in Representative Trone's favor. Inauguration Day is less than 11 months away from me and the 11 new council members, and I'm very excited for the potential we have over the next 4 years to improve the lives of our residents and our businesses and our future. So we think this is a good time to be governing in Maryland and to be governing in Montgomery County. And we have our challenges, but we also have our opportunities. We are going to be driving our opportunities really hard to make sure that people begin to see more benefits now that we're coming out of the worst of the pandemic. On a sadder note, I want to acknowledge the death of former state delegate Sheila Hickson that was announced on Monday. Sheila was not only my representative in Annapolis, but she was a longtime friend. And she was a child of the Michigan Iron Range, and her early work with labor laid the groundwork for her career in public service. And I was always enthralled when she talked about the work she did in the labor movement with her husband during her early years. She had a stellar reputation for putting her constituents and community first, while she represented the interests of Maryland taxpayer as the chair of the Ways and Means Committee, making her the highest ranking woman in the House of Delegates for many, many years. Her kindness and her compassion and her ethical standards made her a trusted voice throughout her almost 4 decades of public service as a state delegate. And Sheila was a leader on many issues that continue to impact the daily lives of Marylanders. She helped usher in significant reforms in the funding and delivery of public education. She oversaw the modernization of our election laws and equipment, and she was a longtime advocate for LGBTQ+ residents in our state and was the lead sponsor of Maryland's landmark 2001 anti-discrimination law. Montgomery County has truly lost one of our great leaders, and we're a better community because of her decades of public service here. We will not forget her, and we really do appreciate everything she did, and my thoughts are with her family and her friends who are all still mourning her loss. On another sad note, there was a deadly crash on Election Day as 2 pedestrians were crossing a road and
Did we lose the county executive? Is he
Yeah.
frozen in everybody's screen?
Yes.
Okay.
Yeah.
Let's give it a second, see if he comes back. And if not, otherwise we'll go to you, either Dr. Stoddard or Mr. O'Donnell. Yeah, his signal appears. Okay. He's back. Can you please unmute Mr. County Executive? Please unmute if you can. Okay. We are having technical difficulties. Just a second, please.
The mouse.
Thank you, Scott. Now, can we tilt the camera just a little bit?
Yes.
Thank you. Perfect.
That good?
Perfect.
Right.
You can continue now. Thank you.
Sorry about that, everybody. So I was talking about the two adults who were killed in a crosswalk yesterday as they were going across to a voting place in Gaithersburg. The two victims were killed by a driver the police said was speeding and likely drunk. These victims died near where they were, where we've tried actually to increase safety by adding pedestrian safety measures to alert drivers when people are in the road and trying to cross the road. And there was fresh crosswalk work done as well. So this isn't an issue of visibility. It's not an issue of, how this was constructed. This is an issue of somebody drunk driving recklessly at a high speed and killing these people as they were crossing the street, too drunk to see people walking in front of them. It is really sad. And despite our efforts, we continue to be in a position that we still cannot correct for gross human error and gross malfeasance. So this is really sad that, no matter what we did or could have done, somebody still being drunk managed to kill two people. My thoughts go out to their friends and their families as well. This is, truly a senseless death. This Friday, we're going to pay tribute to our nation's veterans. In Montgomery County, we honor their service and sacrifice in several different ways. Last year, we added the Service Disabled Veterans Owned Small Business Certification to our Minority Female Disabled Owned Business Program, and it works in coordination with the Small Business Administration and the Department of Veterans Affairs. The goal is to give veterans who own a business an advantage in winning government procurement contracts here. Last year, more than $200 million, or close to 27% of our government spending, went through the program that now includes the veterans. Veterans of Montgomery County also have dozens of providers, agencies, and advocacy organizations available to offer many forms of aid, support, or ways to get involved in the community. On behalf of Montgomery County Commission on Veterans Affairs, I want to invite you to participate in Operation Greenlight. It's a nationwide program to add light to our community, and we're lighting up our Veterans Plaza in green. Other buildings are getting green lights to support veterans and support them in their transition out of service. There are also many community ceremonies on Veterans Day to honor the men and women who have served, starting 11 a.m. in Rockville, Gaithersburg, and Wheaton, and the ceremonies will also be in Bethesda. Germantown will hold a concert at 7 p.m., paying tribute to veterans at Northwest High School. And on Sunday, another ceremony will be led by the American Jewish Veterans Memorial, and it will be held at 2:30 p.m. at Rockville's Bender Jewish Community Center. The county also continues to pay tribute to those who serve by hosting a space online to spotlight veterans who were born, raised, or have other ties to Montgomery County. Categorizes those veterans by service time, and you can find that page by going to the county website, then adding a /Veterans Day. So I hope people take some time to acknowledge the service of our veterans and the losses that we experienced in the county. Other news, Montgomery County is launching its wastewater surveillance project, and Montgomery County has a new public safety tool in the form of a wastewater surveillance system. The project was prompted by a need to monitor community health from threats like COVID-19. And with the help of researchers from the University of Maryland at College Park, we're now able to monitor 5 stations in the county that can help health professionals evaluate when the presence of COVID-19 is elevated in our public wastewater. The information is crucial in evaluating community threats and can give us an early warning system, particularly as fewer and fewer people are using PCR tests to evaluate whether or not they've contracted COVID. This equipment's also adaptable. When we learned polio had recently been found in similar surveillance systems in New York State, I made sure that we added that to the list of dangers that we're monitoring. So we will be monitoring to see if there's any presence of polio emerging in our community. This is just another layer of protection our community needs in this post-pandemic world. And I do look forward to updates on what these tests tell us about our community, and we will be making that information public as we get it. On the COVID front, this week we continue to see an elevated level of respiratory illnesses that are impacting young children and sending them to the hospital. RSV cases are the primary driver of these pediatric hospital visits. COVID-19 also remains a threat in our community. Primarily, we're seeing BA.5 and the subvariants of BA.5 viruses dominating our local case counts. It remains around 90 cases per 100,000, which maintains our community at the community threat level of low. Our transmission levels over the past few weeks have remained steady, which is good news. Bivalent boosters remain our best form of protection from rapid spread of COVID-19 through Montgomery County. Researchers looking at data since the new boosters were introduced say that less than 0.5% of breakthrough cases have come from people who have received the new shot. That's pretty significant. It's an improvement even over where we were before. Unfortunately, the percentage of people getting the new boosters is not nearly as high as when our boosters were first introduced. And we should still be at a peak demand for these new booster shots. We're hoping that more folks come out, and we're dealing with demand that is way down. We're dealing with variants that will not respond as well to the booster shots that you already have. So we're hoping that everybody takes this seriously. I know that for some people, this is frustrating. We're used to vaccines. Some vaccines you think last a lifetime, some vaccines last a year, some vaccines live somewhere between or last somewhere between a year and a lifetime. We're not used to a vaccine that we're getting every 3 months. It's led some people to believe falsely that the vaccines don't work. The fact that we're able to come up with new vaccines is a tribute to all the scientific work that we're capable of doing now. And as the virus mutates, it's important that we're able to create new vaccines that can help protect us from the new strains that are emerging. So people shouldn't look at this as if I have to get it every 3 months, it means they don't work. What it means is we're dealing with an ever-changing virus, and you need to have the protection based on the viruses that are circulating in our population. There are scientists who are working as we speak on a vaccine that would deal with the entire coronavirus family, and that would be a great addition, and it would certainly protect against a wider range of infections, but we're not there yet. So what we have now are vaccines that are effective and can keep you out of a hospital and keep you from dying. You may have to get them renewed as the circumstances of the virus change, but they work. And so I'm just, hoping the folks, take this advice, get themselves vaccinated. You're going to be subjected to this and the flu and this RSV virus. So multiple risks that people could be facing. And if you were to get one or more of these, particularly if you get 2 or more of these, you're looking at things that could more seriously compromise your health. So take advantage of our clinics, take advantage of the fact that these vaccines are available pretty much everywhere now, whether it's our clinics, the drugstores, or grocery stores, or your doctor. They're out there and available. We're also seeing interest in the flu vaccine flatten out at 25% in Montgomery County, and 21% across the entire state. I encourage you to please stay updated on your flu shot. All these things are things we have some control over, and be really, in all of our interests that if you're beyond 2 months past your last booster, that you go out and get the new booster and go get the flu shot while you're out there. In terms of monkeypox or MPX, Montgomery County saw 2 new cases last week, the first new cases in 3 weeks. The state added 8 new cases since our last update. It's a reminder to everyone to be on the lookout for symptoms of the disease, like red welts or itchy scabs. They're a sign that someone you're around may be contagious and that close contact should be avoided. At this point, I'd like to turn this over to Sean O'Donnell for his public health update, and then we'll take questions from the media. Thank you again for joining us today.
Thank you, Mr. County Executive. So going through our pulse report that our colleagues at HHS helped to put together from epidemiological data. The first thing is just a very brief update on the variants. We're continuing to track on these variants. They are, as was mentioned, most of these are of the lineage of BA5. They're related to BA5. You see there's still a little BA4 circulating in our region. The other ones that are mentioned here, the BQ subvariants, the BF subvariants, they are related to BA5. These are all Omicron. And as was mentioned, some vaccines do get updated year to year. The flu vaccine is probably the one people are most familiar with. And, back in September, that was our first update since the original vaccine was developed for COVID. And that update specifically included protection against Omicron, in particular, protection against the BA4 and BA5 subvariants of Omicron. So we're very hopeful that this will help protect against not only reinfections, but potentially, and more importantly, serious illness. What we have been seeing is more cases detected in Montgomery County. This is likely not just attributed to increasing transmission of COVID, but more people are being identified because, as we'll get into, there's a lot more respiratory illness in the country, but also in the county. And with more respiratory illness, people are going and getting tested to see if it's COVID, and we are finding more people who have COVID. You can see that we have had some, as percentages of hospital patients, it's gone down a little bit, and now it's gone up over the last few days a little bit for COVID patients. So we are seeing transmissions of COVID happen. The COVID transmissions have not really come down significantly since going back to the beginning of BA4, BA5. So these are still being transmitted through our community, and we're just asking, particularly people who are at risk to protect themselves, who are at the greatest risk for serious outcomes. We have looked at some of our preliminary data just within Montgomery County to get some ideas of how effective the boosters are. Now, I just want to share the caveat that when comparing the original booster, you can see we're looking at data that went from the original availability of that first booster from August of 2021 through September of 2022, when it was discontinued and the bivalent booster came into use. And the breakthrough cases of people who received one or more of those original boosters was about 6.5% in Montgomery County. The bivalent booster data we have is obviously a much shorter period of time, but you can see we've had a much smaller number of breakthrough cases already in those 2 months associated with people who got the bivalent booster. So we'll continue to monitor this. It is it's helpful for us to try to understand what's going on and share that with the community. Again, this is just in breakthrough cases. Obviously, hospitalizations and serious illness is another way that we look at the effectiveness of vaccinations and boosters. Looking at hospitalizations, again, you can see this is a report that we look at of not only our acute care hospitals and ICU beds, but also the alternate care site. Where we've seen the increase in patients are those that have been transferred from our hospitals over to the alternate care site in Tacoma Park. And looking at our death data, we've been saying for a few weeks now that we were hopeful to see fewer deaths related to COVID in October, because we saw some of the transmissions come down, and so far that's looking like what happened. That's really one of the main outcomes we're trying to reduce is the most severe outcomes for COVID. Looking at additional doses by ages, you can see we do report this. As far as the bivalent booster, 16.6% of our county, of all county residents, have gotten the bivalent booster. When it comes to those who are over 50, that number jumps to almost 28%. Again, everyone is eligible if they've completed at least their first 2 doses, and it's been 2 months since their last COVID shot. Moving on to the bigger picture of what's impacting our hospitals now. This is just emergency department visits over the last year. And you can see in the upper left corner, we reported on this last week, where the numbers were increasing. These are visits. The upper left corner is visits related to with the symptoms of fever and a respiratory illness, a cough or a sore throat. And you can see how those numbers jumped quite a bit over the last several weeks. They continue to go up. We were reporting last week that most of that was being driven by our 0 to 4 and 5 to 17-year-olds. You can see those numbers continue to go up. And we're now starting to see some increases in other age groups as this is beginning to spread a little bit more to the other age groups. But still, the majority of the emergency department visits related to this are pediatric visits. We've added in a chart on the lower left. This looks at all emergency department visits and the volume, the daily volume of visits. And what you can see, if you look a little bit to the left, you can see that previous peak is back to January of 2022. And we are very close to that volume right now. And that's just because there is so much respiratory disease going on. Obviously, last January, a lot of that was the original Omicron COVID driving those visits. So even though it's different diseases that are contributing to this, we are hearing from our hospitals that wait times can be a little bit longer, and there's just a lot of volume there. Looking across the U.S., this is what we've shared. You can see it's not just Montgomery County, but influenza-like illness. Those respiratory illnesses are predominantly in our younger populations, and they're happening across the U.S. at a much earlier time period than previous seasons. On the right is the up-to-date U.S.-wide influenza surveillance. These are actual influenza positive cases reported to the CDC. Influenza is one of those diseases that is often underreported because many people don't actually go and seek healthcare and get tested. But where the numbers are, we're at about 8,000, between 7,000 and 8,000 positive tests reported over the last week. You can see on the chart on the left, which is the last year's volume, that's already about where we were at the peak of this last year. Looking just within Maryland, the same sort of respiratory illness. This is our syndromic surveillance respiratory illness during the influenza season. Again, just in Maryland, not just in Montgomery County, you're seeing most of these cases are pediatric cases. Again, they're happening much earlier in the season. And then specifically, what is influenza? It's certainly a component of what we're looking at here in Maryland. Again, it's happening earlier, and these transmissions are still going up. But influenza does make up a much smaller percentage of these illnesses than, say, COVID, or it appears RSV. So going to RSV, looking at where our cases are, you can see, again, we're much earlier in the season for this. And you can see our season totals at the different ages. These are hospitalizations for RSV. And you can see the hospitalizations are much more significant with the very young populations who are at, greater risk from this disease. Just sharing the CDC is tracking on this, and we talk about case rates sometimes we talk about case rates all the time with COVID. We just wanted to share some data. You can see the case rates for hospitalizations for RSV is the highest case rates are those 0 to 6 months. Those are the children at the greatest risk, again, because it's very difficult for children that age to indicate that they're having trouble breathing. It really does take monitoring if they're having respiratory illnesses. Again, we're recommending for parents, please contact your healthcare provider and have it evaluated. Just looking at the Maryland surveillance, again, we have very high positivity, test positivity. That's the orange line for RSV. You see that test positivity is coming down a little bit. That is the nature of more tests are being given for this. That's the yellow lines underneath. As more tests are given, the test positivity will come down a bit. As our county executive mentioned, within Montgomery County, we're approaching 25%, or 1 in 4 people with the influenza vaccine. Across the state, it's about 19%. Again, we're encouraging people, get protected against influenza, get protected against COVID. We have heard that Pfizer and Moderna are looking at developing an RSV vaccine based on the newer technologies that were used for COVID vaccinations. That's very encouraging. There's just not available yet. It's all encouraging how much more quickly vaccines can be produced now, but they do still take an amount of time before they are approved and available to the public. And then finally, I know our county executive already covered this. There are still cases of monkeypox going on. There were 8 new ones across the state, 2 of which were in Montgomery County. So we're still continuing our surveillance, still following up with cases and recommending those individuals who have not been vaccinated but may be at risk to contact us, and we can vaccinate them. We have plenty of vaccine for that. Those were all the updates we have from the public health side. Dr. Stoddard, do you have anything you'd like to add now?
Yeah, just 2 additional comments. Thank you, Sean. First off, on the pedestrian safety front, with the end of daylight savings on Sunday, this past Sunday, the 6th, we're now firmly in the most dangerous period in Montgomery County and across the country for pedestrian and bicyclist safety. And I want to make that clear because with decreasing daylight hours across the country, you see an increase in risk posed to cyclists and pedestrians. And I want to make very clear the county's position on this. We firmly believe that drivers bear the greatest responsibility in protecting our pedestrians and cyclists. Too often there's a focus on what pedestrians and cyclists can do to keep themselves, and that is an important part of the equation. But frankly, the person operating the vehicle, which is responsible for the damage, bears a massive percentage of the responsibility for protecting everybody on the roadways. And so obviously, as the daylight decreases, driver attentiveness has to be increased to compensate, and drivers have to travel, as the county executive alluded to, at a safe speed, following the clear markings that we have across the county. We continue to make massive investments across the county. I think it's $10.7 million this year alone on lighting improvements and other objectives to improve driving while the daylight hours are decreasing. But obviously this is still an issue where we've got a lot of ways to go as a community and as a country to improve pedestrian and bicyclist safety, but drivers bear such a major responsibility in doing this. The other thing I want to comment on is obviously with the passing of ballot question 4 last night, recreational marijuana legalization is coming to the state of Maryland. But even with the passage, I think it's 65-35 roughly is what I saw, which is great news. I know that's something county executive has long supported. Just recognize that change does not occur immediately. We don't want people going out there prematurely and getting themselves into trouble. That passage does mean that come January 1, there will be decriminalization, and you'll see some modifications on the civil penalties associated with marijuana possession of low quantities. But to be clear, the majority of those effects will not take place until July 1 of 2023, and will require the state legislature to take several additional actions with some regulation and laws passage. So just want to make clear to people out there that your behavior shouldn't necessarily change overnight with the passage of legalization. It's coming, but please act responsibly and lawfully until the changes have been fully enacted by the middle of next year. So those are the 2 comments I want to provide, and look forward to the questions.
Thank you, Dr. Stoddard and Mr. O'Donnell, Mr. County Executive. Members of the media, we open it now for the Q&A portion of this presentation. Please use the chat. I do not see any requests for questions quite yet, but we'll give it a minute or 2.
While we're waiting, can I just make a little comment on the
Yes, you
marijuana?
can.
So on the marijuana legalization, I just want to remind people that this is going to be like alcohol. There may be places where you can drink. You'll certainly be able to smoke in your houses, but you can't do it in public. That's going to continue to be no different than alcohol. You can't walk around the streets with a can of beer or with a margarita, and people are not going to be able to walk around the streets smoking pot. So don't be surprised, because the rules are going to be the same, and they probably should.
Thank you, Mr. County Executive. Members of the media, any questions? No questions for the officials today?
Steve, you feel tired? I mean, what's going on? I know you're up late, at the celebration.
All righty, going once, going twice. Members of the media, no questions? Thank you for joining us this morning, and we'll see you next time. Stay safe. Have a great afternoon. Bye, everybody.
Thank you all.